Hello dear friends, and welcome back to Levitas, your trusted information source for weight loss, health, and wellness insights. In today's video, we're going to explore the number one most common mineral deficiency in the world: iron deficiency. Iron is an essential mineral that plays a crucial role in our bodies. It's a key component of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. Iron is also important for energy production, DNA synthesis, and overall cellular function. Iron benefits. Iron is necessary for the formation of healthy red blood cells and proper oxygen transport. It supports cognitive function, immune health, and muscle strength. Iron also plays a role in maintaining healthy hair, skin, and nails. Here are some of the key benefits of iron. Oxygen transport. Iron is a major component of hemoglobin, a protein in red blood cells that carries oxygen from the lungs to the rest of the body. Without sufficient iron, the body cannot transport oxygen efficiently. Energy production. Iron is essential for cellular energy production. It helps convert nutrients from food into usable energy, supporting bodily functions and physical activity. Muscle function. Iron is a component of myoglobin, a protein in muscle cells that stores oxygen for use during muscle contraction. This helps support muscle health and endurance. Cognitive function. Adequate iron levels are crucial for proper brain function, especially in children and adolescents. Iron supports cognitive development, learning, and memory. Immune health. Iron is important for a healthy immune system. It supports the production and function of immune cells, helping the body fight off infections. DNA synthesis. Iron is necessary for the production of DNA and other genetic material. This is vital for growth, development, and cellular repair. Temperature regulation. Iron helps regulate body temperature by supporting metabolic processes that generate heat and energy. Healthy skin, hair, and nails. Iron plays a role in maintaining healthy skin, hair, and nails. Adequate iron levels contribute to the proper functioning of cells and tissues. Pregnancy support. During pregnancy, iron needs increase to support the growing fetus and increased blood volume. Adequate iron intake helps prevent anemia and promotes healthy fetal development. Prevention of anemia. Sufficient iron intake helps prevent iron deficiency anemia, a condition characterized by low levels of hemoglobin and red blood cells. Healthy pregnancy outcomes. Iron supports a healthy pregnancy by promoting proper fetal growth and reducing the risk of complications such as preterm birth. Enhanced athletic performance. For athletes, adequate iron levels are essential for optimal performance, endurance, and recovery. Prevention of fatigue. Iron helps prevent fatigue by ensuring that oxygen is efficiently delivered to cells and tissues. Hormone synthesis. Iron is involved in the synthesis of certain hormones, including thyroid hormones, which regulate metabolism and energy production. Prevention of restless leg syndrome. Adequate iron levels may help prevent or alleviate symptoms of restless leg syndrome, a condition characterized by an irresistible urge to move the legs. Supports growth and development. In children and adolescents, iron is essential for growth and development, particularly for cognitive and physical development. Normal blood levels and testing. The normal range of iron levels varies by age, gender, and individual factors. Iron levels are typically measured through blood tests such as serum iron, ferritin, and transferrin saturation. Monitoring these levels can help identify deficiencies and guide treatment plans. Here are some common reference ranges for different measurements related to iron status. These ranges may vary depending on where you live. Serum iron. In men, 65 to 176 micrograms per deciliter or 11.6 to 31.4 micromole per liter. Women, 50 to 170 micrograms per deciliter or 9.0 to 30.4 micromole per liter. Ferritin. Men, 20 to 500 nanograms per milliliter or 20 to 500 micrograms per liter. Women, 15 to 200 nanograms per milliliter or 15 to 200 micrograms per liter. Lower ranges in women may be due to menstruation. Transferrin saturation. Men and women, 20 to 50%. Total iron binding capacity. Men and women, 250 to 450 micrograms per deciliter or 45 to 80 micromole per liter. Hemoglobin. Men, 13.8 to 17.2 grams per deciliter. Women, 12.1 to 15.1 grams per deciliter. Hematocrit. Men, 41.5 to 50.4%. Women, 36.9 to 44.6%. All these elements help with the identification of low blood iron levels and the diagnosis of anemia as well. Daily iron dose. The recommended daily allowance, or RDA, for iron varies depending on age, gender, and life stage. For adult men, the RDA is around 8 mg, while for adult women, it is around 18 mg. Pregnant women may require more iron to support fetal development. Types of iron. There are two main types of dietary iron, heme and non-heme. Heme iron is found in animal-based sources like red meat and poultry, while non-heme iron is found in plant-based sources like lentils, beans, and spinach. Heme iron is more easily absorbed by the body. Iron absorption. Iron absorption can vary based on the type of iron and other factors such as stomach acid levels and other dietary components. Pairing iron-rich foods with vitamin C-rich foods can enhance absorption. Iron-rich foods. Iron-rich foods include red meat, liver, poultry, fish, lentils, beans, spinach. Including a variety of these foods in your diet can help maintain healthy iron levels. But remember that plant iron is harder for your body to absorb. Iron and vitamin C as mentioned, consuming vitamin C-rich foods alongside iron-rich foods can increase iron absorption. Examples of vitamin C-rich foods include citrus fruits, bell peppers, lemons, and broccoli, but there are also vitamin C supplements. What are the signs and symptoms of iron deficiency? Iron deficiency, also known as iron deficiency anemia, occurs when there isn't enough iron in the body to produce healthy red blood cells. Iron is essential for producing hemoglobin, a protein in red blood cells that carries oxygen throughout the body. When iron levels are too low, the body's ability to transport oxygen can be compromised, leading to various signs and symptoms. Here are some of the most common signs and symptoms of iron deficiency. Fatigue and weakness. One of the most common symptoms of iron deficiency is persistent fatigue and general weakness. This is due to a lack of oxygen being delivered to the body's cells. Pale skin. Hemoglobin gives blood its red color, so a lack of iron can cause the skin, gums, and inside of the lips to appear paler than usual. Shortness of breath. When the body lacks sufficient oxygen due to low iron levels, it may lead to shortness of breath during everyday activities or even at rest. Dizziness and lightheadedness. Inadequate oxygenation can lead to feelings of dizziness, lightheadedness, and even fainting. Headaches. Frequent headaches can occur due to insufficient oxygen supply to the brain. Cold hands and feet. Poor circulation resulting from low hemoglobin levels may cause a feeling of coldness in the extremities. Brittle nails and hair. Iron deficiency can affect the health of hair and nails, making them more brittle and prone to breakage. Restless legs syndrome. Some people with iron deficiency may experience an urge to move their legs, especially at night, which can disrupt sleep. Pica. Pica is a condition associated with iron deficiency, characterized by a craving for non-food substances such as dirt, ice, or clay. If you or someone you know experiences this, it's important to seek medical advice. Rapid or irregular heartbeat. In severe cases, the heart may have to work harder to pump oxygen-rich blood around the body, leading to a rapid or irregular heartbeat. Chest pain. In more serious cases, a lack of oxygen may cause chest pain or angina. Poor appetite. In children, iron deficiency may result in a decreased appetite. Difficulty concentrating. Lack of oxygen to the brain can lead to difficulty concentrating and cognitive impairment. Increased susceptibility to infections. Iron is important for a healthy immune system, so low iron levels may increase susceptibility to infections. Glossitis and mouth ulcers. Inflammation of the tongue, known as glossitis, and mouth ulcers can occur with iron deficiency. Anemia and types of anemia. Anemia is a condition characterized by a lack of healthy red blood cells. There are different types of anemia, including iron deficiency anemia, which is the most common. This occurs when the body lacks enough iron to produce sufficient red blood cells. Causes of iron deficiency and groups at risk. Iron deficiency can occur due to a variety of reasons, affecting the body's ability to maintain normal levels of iron. Some of the most common causes include inadequate dietary intake. Not consuming enough iron-rich foods, such as red meat, poultry, fish, lentils, beans, spinach, and liver. Poor absorption. Iron absorption can be affected by certain factors, such as gastrointestinal disorders like celiac disease or Crohn's disease, surgeries as in gastric bypass, or medications like antacids. Blood loss. Chronic or acute blood loss can lead to iron deficiency. Common causes include heavy menstrual bleeding, gastrointestinal bleeding from ulcers, hemorrhoids, or other issues, frequent blood donations, and chronic kidney disease. Increased iron demand. Certain life stages or conditions can increase the body's need for iron, such as pregnancy, breastfeeding, and growth spurts in children and adolescents. Parasitic infections. Parasitic infections, such as hookworms or schistosomiasis, can cause blood loss and lead to iron deficiency. Genetic conditions. In some rare cases, genetic disorders can lead to iron deficiency by affecting iron absorption or causing increased blood loss. Inflammatory conditions. Chronic inflammation can interfere with iron metabolism and absorption, leading to deficiency. Conditions like rheumatoid arthritis, chronic kidney disease, and autoimmune disorders can contribute. Excessive exercise. Intense physical activity can increase iron loss through sweat, gastrointestinal bleeding, or hematuria, blood in urine. Dietary inhibitors. Certain compounds found in foods, such as phytates found in whole grains and legumes, polyphenols in tea and coffee, and calcium, can inhibit iron absorption. Low stomach acid. Conditions that reduce stomach acid production, such as atrophic gastritis or use of proton pump inhibitors, can affect the absorption of dietary iron. Iron supplementation. Iron supplements come in various forms, including ferrous sulfate, ferrous gluconate, and ferrous fumarate. The type of supplement and dosage should be determined by your head healthcare professional based on your individual needs. Iron side effects and toxicity. Iron supplements can cause side effects such as constipation, stomach upset, and nausea. Iron toxicity can occur from taking too much iron, which can lead to serious health issues. Iron absorption inhibitors. Certain substances can inhibit iron absorption, including calcium, tannins in tea and coffee, and phytates in whole grains. It's important to be mindful of these factors when planning meals. Iron and detoxification. Iron plays a role in detoxification processes in the body, particularly in the liver. Ensuring adequate iron intake supports overall health and detoxification. In conclusion and to summarize today's video, we explored the number one most common mineral deficiency in the world, iron deficiency. We discussed the essential role iron plays in our bodies, including supporting healthy red blood cells, energy production, cognitive function, immune health, and muscle strength. Iron benefits extend to maintaining healthy oxygenation, hair, skin, and nails, making it a critical component for overall well-being. To ensure your body receives enough iron, you should be aware of your normal blood levels, which can be determined through blood tests such as serum iron, ferritin, and transferrin saturation. The daily recommended intake of iron varies depending on age, gender, and life stage. Adult men need around 8 mg, while adult women require around 18 mg, and pregnant women need more iron to support fetal development. We also learned about the two types of dietary iron, heme and non-heme. Heme iron from animal sources is more easily absorbed than non-heme iron from plant sources. Iron absorption can vary depending on dietary components and other factors. Consuming vitamin C-rich foods with iron-rich foods can enhance absorption. Iron-rich foods include red meat, poultry, fish, lentils, beans, spinach, and cow or chicken liver. Iron deficiency can lead to symptoms such as fatigue, weakness, pale skin, brittle nails, and shortness of breath. In more severe cases, it can result in anemia. Anemia is characterized by a lack of healthy red blood cells and can take different forms, with iron deficiency anemia being the most common. Also, the condition known as pica, which is associated with iron deficiency and characterized by cravings for non-food substances. If you or someone you know experiences this, it is essential to seek medical advice and seriously consider supplementation. The causes of iron deficiency can vary, including inadequate dietary intake, blood loss, and increased iron needs during pregnancy. Groups at risk include women, young children, vegetarians, and individuals with certain medical conditions. Iron supplementation may be necessary for those with low iron levels. Various forms of iron supplements are available, including ferrous sulfate, ferrous gluconate, and ferrous fumarate. While iron supplementation can be beneficial, it's important to be aware of potential side effects such as constipation, stomach upset, and nausea. Iron toxicity can also occur from taking excessive amounts of iron, which can lead to serious liver health issues and other problems. Certain substances can inhibit iron absorption, including calcium, tannins in tea and coffee, and phytates in whole grains. Being mindful of these inhibitors is important when planning meals to maximize iron absorption. Iron also plays a role in detoxification processes in the body, particularly in the liver, supporting overall health and detoxification. Understanding the importance of iron and how to maintain healthy levels is crucial for your overall well-being. By making informed dietary choices, you can ensure your body receives the right amount of iron to thrive. Thank you for tuning into Levitas. If you found this video helpful and informative, be sure to share it with your friends and family, give it a thumbs up, subscribe to our channel and hit the bell icon to receive notifications for future videos on weight loss, health and fitness content. Also, leave a comment sharing your questions, thoughts and experiences with iron deficiency. We love hearing from you. Your support is very appreciated. It helps us grow and create even content for empowering you to achieve a better body and optimal health every week. Remember to fuel your body with the right nutrients, stay consistent with your training, and keep striving for your fitness goals. Until next time, remain tuned to Levitas for more expert advice to help you on your health and fitness journey. So, stay healthy, stay happy, and keep going.